Piers Morgan, our favourite presenter on television, Pat.
Yes, Piers Morgan is the host of Good Morning Britain. If you watch that program, I don't know anybody who does, but we do come across the clips of it from sometimes. So Piers Morgan has been virtue signaling, as people know, on lockdown and vaccines, and offering on camera to be taking it with Matt Hancock to get jabbed on camera. Remember that?
Yes.
So and so he's come out recently. He had Dr. Hillary Jones, who's a sort of a television, high-profile TV doctor, right? He had Hillary Jones on recently. Watch this clip, and basically they're really upset because NHS staff are not taking the vaccine for some reason. And Piers Morgan is just beside himself. And Hillary Jones is offering a scientific explanation as to why.
It's said that as many as 200,000 NHS and care employees have refused to take the jab despite being offered it and despite working in close proximity to very vulnerable, sick people. I've talked about this a lot, but I'm appalled by this.
Yeah.
And I really think it's not acceptable. And if you work in NHS and care work, and you're a potential risk to the people you're caring for, you either have the jab or you don't go to work, I think.
Look, we know that about 450 or more COVID cases a day are required in hospitals. So if you've got staff who are potentially able to transmit the virus to you, they shouldn't be in that hospital. Would you expect a surgeon to operate on you if they were HIV positive? Would you expect a surgeon to operate if you hepatitis B positive? No, they're not allowed to. So if you've got staff who could infect their patients, then they're not being professionally responsible. Now, I know a lot of them are not on the front line. I know a lot of them are on almost minimum wage.
So they're working.
It's irrelevant. It's irrelevant. They're looking after patients. They should.
It doesn't matter how much they earn. It's where they're working. They're working inside hospitals and care homes.
Yes.
And we know that 25% or more of infections are happening inside hospital.
Yes.
What do you think of that?
I think he's very upset about things.
So Dr. Hillary Jones is saying that the NHS staff not taking the COVID vaccine is the equivalent of them being HIV super spreaders running around hospitals. I mean, absolutely a preposterous thing to say on national TV by a supposed qualified doctor there. But the point is, it's that you're assumed to be infectious and dangerous unless vaccinated. Tell me what is scientific about that assumption?
Nothing at all.
It flies in the face of hundreds of years of good medical practice. But this is the sort of hysteria and wild hypochondria rhetoric that we're seeing on our mainstream top flagship morning shows in the country. And so Piers Morgan, just remember, he's having a go at the NHS staff, Mike. Well, it wasn't long ago that Piers Morgan has the NHS as his profile on Twitter. He took it off recently, but here he is. Basically, he was, they were saying that he shouldn't get his vaccine before somebody who needed it. So he's saying, I'm a key worker, Piers Morgan, because I'm a journalist covering coronavirus. So I am essential key worker. This was in May of 2020. So I mean,
the propagandist.
He's been doing this now for months and browbeating people who are questioning any of the policies or the lockdowns. He's literally an extension of Boris Johnson on mainstream TV. And what are Piers Morgan's qualifications to really know what he's talking about for any of this? He's just a pundit. He's a highly paid. I don't know what he gets paid per year, probably in the millions.
Yes.
But he gets paid, doesn't have any particular skill set or expertise, but yet he is browbeating the public at every turn. And he brings on Dr. Hillary Jones and accuses 200,000 NHS staff of being the equivalent of HIV spreaders in the health system. I mean, unbelievable. I think a public apology or just disappearing and not being on TV anymore.
Sadly, neither of those is likely, but there you go. But anyway, look, let's bring this on.